helping make your life easier. Moms Every Day.
Hey everybody, welcome to Moms Every Day. I'm Hattie Cheek. We have Jennie Yoost with us today from Cabell Huntington Hospital. And we have talked about this topic a few times before, but we really only grazed the surface. So we've been talking a lot about getting your shots and everything before going back to school, but there are some that are definitely at your own discretion to decide if you want to get them. And one in particular that I've had a lot of doctors talk to me about is the HPV shot. When did it come out? It came out in
2006.
Yeah, I was going to say somewhere around 10 years ago. So I was roughly correct on that.
Yeah.
And talk about what it is and why parents should consider it.
Sure. So HPV is human papillomavirus. It's a virus, and it's the most common sexually transmitted disease. And the thing that's different about it, when we talk about STDs, sometimes people correlate that with high-risk activity.
Yeah.
And HPV is really different. It's kind of more of a marker of sexual activity, and it's an infection that most people get exposed to. So the majority of men and women will get infected with at least one type of HPV within their lifetime. So it's very, very common.
And it doesn't necessarily mark you as a risque person.
No.
It has that stigma at times when you say sexually transmitted disease, but that's not exactly what's going on with HPV. I think I read a statistic once that 80% of people, that's roughly correct? 80% of people have at least been exposed to it.
Exactly.
All right, and so that's an overwhelming amount of people. If you think about everyone who's in the world, there's only 20% who haven't been exposed to it. So there is a vaccination now, and how is that process? Who should be getting it? How old are you?
Well, the biggest thing is that HPV can cause cancer, can cause cervical cancer, vaginal cancer, vulvar cancer, anal cancer, penile cancer. So cancers in both boys and girls. So the vaccine is actually targeted to both boys and girls, age 11 and 12, so a young age. You can get it up to age 26 for females and up to age 21 for males.
Okay, so all right, so there is an age difference. So usually you stop making those kinds of decisions for your children at 18. If you do know your child is 21 or getting to that 26 mark, it is definitely important to talk to them about it to see what's going on. Boys have to get it done when they're younger. That's interesting.
So, well, it's recommended for both of them at age 11 or 12.
Okay.
So that's the target age you really want to focus on. But if they miss it at that target age, they can get it up to age 26 or 21, respectively.
I imagine most people would say 11 or 12. I have to take my 11 or 12-year-old child to go get a shot like this. It's preventative.
Sure, absolutely.
Planning for the future just in case.
That's one of those myths, is that, oh, I'm just going to wait till my kid's older. They're not sexually active right now. I don't need to worry about it, when really that's not the right thing to do. At age 11 or 12, one, we know they've likely not been exposed to HPV. And plus, they actually have a better immune response at that age. And that's why other vaccines like Tdap and meningitis are recommended at the same age. So it's the ideal time to vaccinate them.
And if you want to do it, you can just throw it in with the other vaccinations.
Absolutely.
Do you recommend explaining what it is to them when they get it?
Absolutely. And I think the message is this is cancer prevention. So this is a virus that majority of people get exposed to. It causes cancer, and this vaccine will decrease your risk of any of these types of HPV-associated cancers.
Right. So you're saying it prevents cancer. How effective has it proven to be?
It's very effective, actually. When we look at clinical trials that have studied the vaccine, among the women who got the vaccine, they had up to 100% protection against the development of cervical precancers. And genital warts, the same thing. So HPV is also linked to genital warts. And so women and men who received the vaccine had up to 100% protection against the development of genital warts.
And 100% is not usually something that we hear of when it comes to any kind of shot or prevention method. 100% is a big deal. Talk about the vaccine's safety. Some people don't like getting vaccines at all.
Sure. The vaccine's very safe. Vaccines have to go through a pretty strenuous process before they're even approved. And then once the FDA approves a vaccine, they continue to monitor it through several different pretty elaborate systems for the Center for Disease Control. Anybody anywhere can report an adverse event, and these things are monitored prospectively over time to see if there's any trends. Over 50 million doses of HPV vaccine have been distributed within the United States, and to date this vaccine is very safe and effective. The common side effects are things like soreness at the injection site, a little bit of redness and swelling, maybe a headache or a low-grade fever.
Okay, so your typical effects of getting any kind of shot that we have to get every single year. Tetanus, I know that's one of those required, and that can be one of the most very painful ones. So at least that's some, you know, can console you a little bit if you're not one of those people who like to get shots. If you do need any more information, though, you know who to go to. You can just go to our website. It'll tell you how to reach out to Jennie from Cabell Huntington Hospital. You can rewatch this interview and kind of get to know the HPV shot just a little bit better if you're just learning about it now. Thank you for joining us for Moms Every Day. We'll be right back after the break with more moms. Stick with us.